through and how it's affecting, himself, his family, just work in general. So I really appreciate him taking out his time. I'm sure he's super busy, so I appreciate him coming here today. And the first question I actually have is to tell us a little bit about yourself and tell us how you're doing.
So, hi everyone. My name is Stanley Cadet. I graduated SUNY Cortland in 2008. There, I was a health science major. I had a minor in biology, and what attracted me to Cortland originally was I loved playing football and running track, and it was one of the only schools that allowed me to do both of them. So that's what originally got me into Cortland, and once I got there, I loved it. And I have some of the best friends that I have for life from there. So other than that part, work has been busy. I'm in upstate New York, so thankfully it's not as crazy as down in the New York City area, but I think everyone is generally having a hard time, I think, with making all the adjustments as a society, and even for our kids, they're making an adjustment. I think it's been a big deal moving forward. But
yeah, and I think the hardest part has been, what do you tell the kids, and everybody's so not adjusted to this, even though we've been doing it now since March, but it's been quite the adjustment. Have you seen, when we talk about kids, have you seen anything, involving the children that you can talk about?
So I haven't personally seen any child with coronavirus. I think I know that it's been mentioned on the news there that children are getting like an inflammatory lung disease as a side effect of COVID. I think even with that being said, I think the numbers are too small to really I guess go crazy about it in that. I think generally staying safe and social distancing across the board, I think is what's helpful, because there's not much. The thing about coronavirus is not much experience from a medical perspective to say this is what works and this is what doesn't work. I think even the highest level people in the medical community, usually if there's a disease, there's a pathophysiology, there's a textbook, there's a guideline on it. So right now, we're not at that point. We're actively going through the disease to get to the point where we can look at it in a textbook and say, for coronavirus, we give this med, that med, and it goes away in 6 to 8 weeks or whatever. But we're not at that point, and that's what's scary about it. But in terms of children, no, I have not seen anything yet.
Yeah. So can you, well, the next thing that I'd like to ask is, can you tell us why you chose this career field?
Oh, okay. So I forgot to mention also too, I'm a nurse practitioner. I work as a nurse practitioner hospitalist. What a hospitalist is instead of, everyone has an outpatient primary care physician. When they go to the hospital, in the past, physicians used to follow their patients into the hospital. Now, with in the last 10 years, with the explosion of healthcare reform and everything, a new position called the hospitalist was formed, and these are stand-in nurse practitioners or doctors that anybody that comes into the hospital, you get admitted to our service, and we take over for the primary care physician. So that's kind of what I do. I went into it. I always loved the healthcare field. My dad, he was a physician in Haiti, and I'm a first-generation immigrant. He, since I was a kid, he would give me these picture medical textbooks, and I used to think that it was like a coloring book or like a picture book, but it was actually really his the same books that he studied from. So since that point, I kind of absorbed a lot of it, and I always knew that I wanted to be somewhere in the healthcare field, and that's part of the reason why. And I wanted to help people. Really, I'm really like a social person. I really couldn't picture myself doing something that's not involving touching people and transferring positive energy. I truly believe in that. And I think that's something that actually does help people get better. I think if you have a positive attitude, I think that someone on the other side or someone next to you can feel that, and that helps. So, yeah.
It's great. So can you tell us about COVID-19? And in your opinion, why has it impacted us so much?
I think, so coronavirus COVID-19 is a strain of the everyday normal coronavirus that causes the common cold. The exact pathology of why it happened, it's still being researched. It could be, some people say theories that it's a man-made virus. I think they're saying that because the way that it acts, it's very aggressive, very contagious. Normally viruses don't like hot weather. They come in cold weather. They last for 2 to 3 months and then they go away. The issue is, as we know, this isn't going away. It's acting in a weird way that's not typical of a normal virus. It's transferred through droplet, meaning when you cough, the virus is in droplets of your mucus. It lands on a surface. It can live there for greater than a week, and you put it. The thought process is you touch the droplet, then you touch your mucous membrane, and that's how you get it. I think that the way I can speak on the urban areas and metropolitan areas. The reasons why it's so bad there is because from a architectural layout, you have big buildings, you have a dense population. Let's say 5,000 people are living in a skyline apartment or a skyrise building. There's one elevator going up and down. So that's you have a way of transporting the infection, and you have a dense amount of people in one area. So imagine, I mean, you right now, you look like you're in a house, right? Imagine having 3,000 people live above you.
Right.
So yeah, I can imagine how it spreads like wildfire. I think that's why those dense populated areas. I'm from Long Island. I know there's a lot of cases there and in the city. The same thing with Long Island. It's a dense population. The layout is a little bit different, and that's why it's happening. And I wanted to just mention it, to take it a little bit further. There's a socioeconomic aspect of that too. So for example, urban areas, they happen to have more lower socioeconomic status, less access to cleaner air, less access to more higher risks for secondary comorbidities, high blood pressure, high stress environment, things of that nature that would make smoking cigarettes, that would make having the coronavirus and the severity of this coronavirus go up based on that line of thinking. So that's why you look in the news and it's like, oh wow, it looks like it's really bad there, but in your town, in the suburbs, it's not. You know of cases, but it doesn't seem to be as bad. But that's the reason, from my perspective.
We have a question. They said,
okay.
Stanley, we're in Long Island.
Oh, I grew up in Hicksville, Long Island. Yeah.
Susan. She's from Massapequa.
Oh, we played each other in high school.
There you go.
High school rivals.
There you go. Okay. So what has been your personal experience with COVID? So, and I know that you're there in Cortland. I think you have mentioned you're in New York. You kind of travel between New York, Portland, and Albany. Is that correct?
Yes.
What has been your experience with each of those?
In Cortland, it's a rural area, a small community hospital. Not many cases there. When I have gone to those areas like Albany, a little bit denser, more of a 90. Like there's certain hospitals that are 95% COVID hospitals, meaning the 5% that's non-COVID is the cafeteria, the cafeteria and like the employee bathrooms. But the thinking is the whole hospital is dirty. So you come in, you wear your N95, they actually issued scrubs, hospital issued scrubs, and you are in there the entire time, and then you leave. So a lot of my colleagues like to cluster their days when they go to these hospitals. They do 3 in a row or 4 in a row, and just basically say, hey, look, we're going to just be in COVID, and for these 4 days, and we have a 6-day off stretch, then we can go back. But the type of patients that I've been seeing, mostly elderly, and the younger patients are smokers. I had one patient who was an asthmatic, and he got better. I was able to discharge him home. But I asked him more about his history. He's been fighting asthma for his whole life. He had asthma so bad that at one point in his life, he needed to go on a breathing machine just for asthma alone.
Yeah.
So he had a high risk. So he ended up getting COVID years later during this pandemic. But if you look at it, it does attack high risk patients. Anyone, yes, can get it, but the ones that have complications tend to be more elderly, immunocompromised, and or young with some sort of history of smoking, asthma, interstitial lung disease, something like that.
Yeah. You mentioned your coworkers. Have any of your coworkers had any experience with COVID? Is anybody that you know getting sick from working the front lines?
Thankfully, no one that I directly know has gotten sick. I've heard of, I've been to places where nurses have been sick and been hospitalized. But no, but it is, yes, I have heard of that more than once, actually. So, yeah.
So how do you feel the medical field has been impacted?
So there's a multi-factorial way of how this has been impacted. In terms of, there's twofold. In the urban areas, Long Island, the city, the hospitals they were at a period where they couldn't handle it. They didn't have enough staff to take on the burden of the amount of patients. Those were isolated to those heavy traffic areas. They had to have contract people come in and help or volunteer. When you go to the outskirts of little community hospitals where, say, they haven't had many cases, some hospitals have seen 60, 70% decrease in business and revenue. So a lot of these hospitals are partially shutting down. A lot of layoffs in the majority of the hospitals, other than the big city areas. That's how it's be, and a lot of the doctors and physicians are transferring to a telemedicine model. And I think that's something, the telemedicine has always been there, but I think now moving forward, now that we've had this, you're going to see that going to the doctor even 2 years from now is not going to look the same as it did before coronavirus. So, which I'm not, you take it in two ways. I personally think I'm old school. I think touching the patient and physically being face to face and seeing certain nuances does help. I'm not sure how that's going to be affected moving forward when there's going to be telemedicine involved, So
that leads me into my next question is, how do you think the medical field will be impacted as we move forward? Like, what do you think are going to be some of those major changes, and do you think they will all stay? Like, will it be this way, or do you think we'll get back to our norm? Or
I think it's, at the end of the day, there's more than just coronavirus in terms of things that can get you, that can make you sick. I think it's really important as medical professionals that we don't get lost in, okay, it's corona. What about diabetes, hypertension? There's, people have surgeries. People will have their gallbladder taken out. So I think that brick and mortar medicine will always be there to a certain extent, because there's certain things that you can't do on telemedicine. You need a face-to-face physician, PA or nurse practitioner, someone to evaluate you in person. I think there might be some downsizing, because I think from a business perspective, a lot of the hospitals are going to try to save money. And I think that's what we're going to start seeing. We're going to see less MDs staffed in the hospital. They're going to try to fill it with mid-levels like myself or PAs to try to save money. Nursing, in certain areas, they're going to cut back. In certain specialties, they may cut back that they may not need. And I think it's still hard to tell. I'm still, figuring it out myself. Even us, in the tiny hospital that I was at, not the big hospitals, they across the board decreased everyone by 10% in terms of revenue and salary, which we took it as okay. At least it's better than nothing. Than not having a place to work. So I think moving forward, we're going to see more of that. And I think that's the big takeaway from it. And telemedicine, I think, is just going to grow. It's just going to skyrocket.
Yeah.
So
if you had to give folks advice today, what advice would you give them?
I would say, don't live your life in fear. I think it's important to take precautions. But what I'm seeing is a lot of people are afraid to go to the hospital and afraid to go to the doctor. And I think that's going to lead to more problems. I think that, proper hand washing, avoiding big crowds is very big. And I think going into the summer, I think it's important as a community that we don't get frustrated and just go into the big crowds and not take precautions because the sun's out and you're sick of being in quarantine. I think part of the reasons why where we live in some of the suburbs, the numbers are getting better is because we did do the social distancing. I think it actually worked. So that's part. I think that for me, I think that's if anything were to go wrong, I think that may be part of it.
Yeah, I agree. Well, now it's time for the panelists to ask you questions. So if there's anybody that has any questions, feel free to type it in the chat and we can ask some questions to Stanley. I agree, though. It's hard when you're in the sun. You think you start noticing, even when you're driving around, you notice people starting to.
There's a lot of movement going on.
Yeah.
And
myself.
Yeah, I did, and I'm the same way too. I'm like, but I think part of the reason is because it's like, if you think about it, we did social distance for the last 2 months, and maybe that's what it's hard to prove that that's not the reason,
Right. I know. And it just gets hard when you're sitting in with families and everybody.
Yeah.
I just still sit here. So we got Tina says, thank you for doing the work you do. Stay safe. Susan says, how do you tactfully suggest to folks at the grocery store, young and old, to wear a mask?
So in the general public's defense, no, we weren't trained on properly donning a mask, and something called aseptic technique which is what we do in the hospital. It's hard because I see people put it on masks and then they touch the front of the mask and drop it and to talk, and meanwhile the mask is acting like a barrier. So all the germs are on the front of that mask. So you shouldn't touch the mask. You should touch it from your ear and take it off. So I think that would be helpful to kind of, maybe if there was some programming on TV to kind of teach people how to wear a mask and how it works. And I think that's what I see in the stores a lot. And I look at it too, and I'm kind of like,
Well, that's a good point, because I have to say I'm probably one of those people I didn't even think about once you touch the front of it, kind of thing. What I learned, do the sides.
Yeah. So that's part of it.
Perfect. Any other questions here for Stanley? Doesn't look, oh, wait. Do you support mask wearing at this point, or should people try to expose themselves to establish antibodies?
So that's a very good question. I'll try not to be long-winded on this. So the first part, mask. So what she's suggesting is should we let people have herd immunity when it comes to this coronavirus, as compared to the common cold or the flu? I think in the short period of time when it was rapidly, I want to say I do actually agree with you. I do think to a certain extent, moving forward in the long term, I think we have to loosen the reins on social distancing, because it's a natural fact of life. It is, pandemics come and go, and it's almost in a sense the circle of life, right? There's every some odd 100 years, there's a sickness that comes in, X amount of people pass away. Usually they're the weak or sick, and then you don't see anything for another 150 or so years. I think it's tough to answer. I think right now in the immediate time frame, precautions and mask wearing is to protect the masses. In the long term, I think we're going to have to let people get sick to a certain extent. An example I'm going to give you is roughly for Vietnam War, for example, roughly say, I'm not sure the exact number, but let's say 100,000 people died in the Vietnam War over a 6 to 8 year period of the Vietnam War. 100,000 people died of coronavirus in 2 months, 3 months period in the US. So that's a problem. If you stratify the numbers, that's where the mask wearing and the protection and the social distancing come into play, because 100,000 in the grand scheme of the United States still isn't a lot of people. However, that time frame is very lethal, and I think that if you march that along every 3 months, and those same amounts of people are dying, then that's a huge problem, because huge civil wars happened and not that many people died in that stratified time frame. So tough question to answer. I hope I kind of gave you an idea, but yes and no. Yes and no type of answer. Yeah.
Yeah.
Mm-hmm.
Anybody else?
No problem.
Yeah. Did you see the thank you?
Yeah.
I'm not sure what you can see.
Yeah.
Thank you, Tina. Anybody else have any other questions? Are you involved in research for the vaccine?
So no, unfortunately, I'm not. I know a lot of hospitals are doing research. They actually, in Syracuse, they did the government did a random testing in the supermarket. They just randomly just picked anyone and on the spot tested people, just to show to match the percentage of the amount of people that have it in the community. So it all was about 1%, even with those numbers. But I know they are working on a vaccine. Probably, I work in the healthcare field, so I'd probably be mandated to take it. But I'm not. Well, I would like to be, but I'm not.
Great question. Thank you, Susan.
Yeah, thank you.
We'll do any other questions? That looks like it's it. I want to say thank you to Stanley. I appreciate your time very, very much.
Thank you.
I know you're super busy. And thank you to everybody who joined us today. I hope you enjoyed listening to Stanley and getting a chance to meet Stanley. And we hope to have him back again sometime soon. Thanks, Stanley.
Thank you.
Have a good night. Thank you, everybody.
Bye, guys. Thank you.
Bye.
Bye.
Bye.